Good morning. I'm Dr. Duke Majan. It is June 26, 2025. Our patient travels here from Texas. She's had neck pain going on several years, 3 years to be exact. We did a MRI review virtually with her and determined that her pain was coming from two sources. One, she has a herniated/degenerated disc at C5-C6, which we're going to fix next. And two, she has facet joint pain. Shot? Where am I going to be able to see this? I guess I'll look there, Jordan. Actually, it'd be better if I was on your side, Luis. Okay. Let's switch sides. That way I can look at the big screen. So she was determined to have two problems, the disc and then the facet. And the way we fix this, we can do them both on the same surgery, but we have to start with the facet. So we're going to start with her cervical facets. The treatment is something called the Duke plasma rhizotomy. Now, compared to other types of rhizotomy, the Duke plasma rhizotomy is a permanent rhizotomy. We permanently get rid of her pain. And other types of rhizotomy, like radiofrequency ablation, which is done all over the world, does not permanently get rid of pain from the facet joint. It's temporary. How's blood pressure? So we're doing her facets first. I've made a 4 millimeter incision, and then I'm going to go down with my probe down to her spine, and I'm going to place the tip of my probe, we call it the Duke plasma wand, right on the area of her spine. Jordan will show it to you on that x-ray, right where the pain nerve to the facet joint wraps around that lateral mass and innervates the facet. That's exactly where it is. You guys see that waist right there? Shot?
Yes, we do. So
my probe, well, I'm too medial. So you have to get the probe in just the right spot. Otherwise, this procedure won't work. Shot? Very good. 2, 3. Shot. So while I'm talking to you, I'm trying to get the probe positioned perfectly. Shot. Now, while I'm doing this positioning of the probe to do the Duke plasma rhizotomy, Henry, show the audience all the different causes of neck pain, because there's about 30 different causes of neck pain. I'm Dr. Duke Majan, CEO and founder of the Duke Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Duke plasma rhizotomy is the best treatment in the world available for painful facet joints. Duke laser disc repair is is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. All right, welcome back. You can see from the animation that there are 30 specific causes of neck pain. And the causes include the discs, which are the most common cause for neck pain, followed by the facet joints, which is what we're treating right now. Now this patient has both disc and facet pain, so we're going to do both treatments for her. I've already treated the facets above, and now I've got one more to do right down here. But you got to get the tip of the probe in just the right spot, and that's about it right there. You can see I'm just at the lateral margin of the lateral mass. Any questions from the audience?
No current questions, so we do have a comment coming from Lanu on YouTube.
Hello, Lanu. Welcome. Sean?
Saying, I still think you should be in the Spine Scam movie. You have a talent in comedy.
I appreciate that, but my wife keeps telling me nobody wants to see you in the movie, so I agree with her. I think we've got a great cast. I'm hoping that Netflix picks it up and basically reshoots it with A-listers, because I think it's a great movie. I think it's a very entertaining, very interesting subject. I think a lot of people want to know more about it. Thank you, though. All right, we're done with the left side. I'm going to move to the right side. In the meantime, Henry, let's show the audience how it is that facet joints can be so painful. Shot. And welcome back. You can see from the animation that the facet joints become injured like any joint in your body with something called trauma. And trauma basically is just a very strong force being applied to a joint where two bones meet, and that force is being applied in such a way that it causes a failure of the ligaments that hold the joint together, right? So the bones are being held together by what's called soft tissue ligaments, and those ligaments, well, they can't, they can withstand a lot of force, but they can't withstand basically too much force, right? So when there's too much force applied to the joint, to the bones, they're moving in opposite directions, then the ligament tears. And when the ligament tears, in this case the capsule of the joint for the facets, when those ligaments and capsules tear, they create what's called inflammation in those capsules. And unfortunately, over time it doesn't heal properly because we're moving our neck around, and that movement of the neck causes the capsules to re-tear. Every time they start to heal just a little bit, they re-tear, and then over time you get this chronic inflammation happening in those in the capsule. And that's what you saw in the video. Did we show the audience how we cure that pain?
Not yet.
Let's do that.
Of course.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. the inflamed facet joint pain nerves are destroyed. The advantages with the Duke plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Okay, you saw the video of how we do this. You can see the incisions on each side. They're only 4 millimeters long, and this is all the blood for the whole surgery. The other way to fix this, folks, is a fusion. If we fused her spine, that would get rid of this pain as well. But who wants a fusion? Nobody. Fusions are dangerous, they're invasive, and now they're completely unnecessary. You don't need a fusion for this problem. We can fix it in 10 minutes with a very simple, elegant procedure called the Duke plasma rhizotomy that we pioneered here at Duke Spine Institute. You just saw the video on it. Basically, we target the pain nerve to each joint, and we destroy that pain nerve. Now, the RFA is supposed to do the same thing, but it doesn't work. So that's why RFA has to be repeated over and over and over again the rest of your life. But with the Duke plasma rhizotomy, it's a one-time, one treatment, and then the pain is gone permanently. All right, we'll take the question and then we'll end the stream.
Coming from Faisal on Facebook, asking, what do you think about robotics and navigation to assist spine surgery? Can it help the surgeon see more of the anatomy of the spine? Thank you.
Yes, robotics are completely unnecessary in this time. They don't help. They only delay. And you have to add additional tests like CAT scans, which add radiation to the patient, which you don't want to do. So robotic is completely unnecessary. You don't need any navigational assistance. If you're a good surgeon, trained well, attentive, you care about the patients, you study the anatomy, you understand it, you don't need a robot to do the surgery. Robots will never make this surgery better. And neither will navigation. You just need an X-ray machine and the equipment we use, and our results are as good as you can get. You cannot humanly get better results. You cannot AI or robotically get better results. Those robots and AI and navigation are only going to add uncertainty and increase the rate of complications, in my opinion. All right, thanks for joining us. We'll be back in 10 minutes for the cervical Duke laser disc repair. Remember, she's got pain from her disc and her facets. We've only treated the facet so far. We're going to come back and treat her disc at C5-C6 with laser.